Good evening, and we're going to try this one more time for CancerBuddy Conversations and introducing Karen Fancher, our oncology pharmacist, and see if this works. So, sorry about the delay, but let's try one more time to see if I see that she's on. Here, okay. Okay, I think she's joining now. Let's see if she gets on. Yep, there she is. Hi.
Oh, yay!
Technology. So frustrating.
Oh, thank you everybody for your patience. I don't know what that was about, but here we are.
Yes, I know. It's crazy. Well, welcome to CancerBuddy Conversations, and welcome to CancerBuddy, and talking about the importance of being a pharmacist in the oncology community. And just to introduce you, Dr. Fancher is a pharmacist and at the University of Pittsburgh Medical Center and a HOPA ambassador. And welcome to the Bone Marrow and Cancer Foundation and CancerBuddy. So,
the privilege to be here.
Yeah, so now we're on. So hopefully everybody that was on before will join again. But this is the hardest part of doing these Instagrams. It's like a little bit of a crapshoot every time.
Well, I have a teenager in the house, and I almost went and got him to give me some assistance here,
Yeah.
but I'm glad we got it figured out.
Okay, good. Okay. Well, I would love for you to start out by explaining the role of oncology pharmacists.
Sure.
And how that possibly differs from a regular pharmacist.
Sure. So most people have in their mind that a pharmacist is somebody that stands behind the counter, and counts by fives and puts the label on the bottle and gives you your drugs. And there are some pharmacists that do that, and it is a very important part of the medical profession, that type of pharmacy. But oncology pharmacists, we mostly have a different role. So many of us have additional training beyond pharmacy school. We've gone to school for additional years, sometimes 2 or more, to just learn the cancer drugs. So we're the true experts in the drug therapy of cancer. We're part of a team, obviously, that has many different experts, but we're the ones that kind of own the drug space. So we're the ones that the physicians and the medical team looks to when a patient is very complicated. So for example, the patient has cancer, but also has kidney problems. Well, I'm the one that knows the drugs, which ones affect the kidneys, which ones don't affect the kidneys. Likewise, we're in most cases, or many cases, the ones that manage all the side effects. We're the ones that you would speak to if you have a side effect that doesn't require that you get admitted to the hospital, but yet could be managed at home. So many of my colleagues work in clinics where the pharmacist would handle if you're having a headache or a rash or your blood pressure going up. So we're the ones that our little niche is truly the drugs that are used to treat cancer. And many of us have a visible role. You'll see us in your clinic or you'll see us on the floors of the hospital, not so much behind the counter or making the chemo that a traditional role might have.
Wow. Thank you for explaining that, because I think that a lot of us have the perception that the pharmacist is standing behind the counter just doing the meds and not, very integral part of the team.
Right.
And who obviously the oncologists and doctors really count on to get guidance for their patients. So that's great to kind of explain that. And in terms of, expertise in terms of like oncology and chemotherapies and different sort of drugs, do you, possibly also like reduce the, the strength of it or do different adjustments for patients?
Sure. Yeah. So depending on what the patient's situation is, it might be appropriate to reduce the dose of chemo or whatever drug we're discussing, not necessarily chemo, but other drugs that are involved in the treatment. So sometimes we reduce it, sometimes we hold it, like we give the patient a break, 2 weeks off to kind of recover. But in some cases, like I have a patient today that is doing so well that we actually increase the dose of his drugs.
Wow.
So yeah, so that situation is a little more, less common. But yeah, we do a lot of what I would call tweaking, like adjusting slightly for that individual patient and what they can handle at this time, and what is better for the long run. Mm-hmm.
Do you work with pediatrics as well as adults, or mostly adults?
Yeah, so my practice is all adults. Like where I work right now is all adults, mostly geriatrics, actually. I work with a lot of elderly patients. Pediatric oncology is even more specialized because children's bodies don't work the way adults do. So that takes even more training. I have the highest respect for everybody who does pediatrics.
Yeah, because a lot of the drugs are really made for adults, and then they have to adjust it accordingly.
And they've been studied in adults, so we're adjusting for somebody whose organs haven't fully developed, or is a much smaller body size than an adult. Yeah, so pediatrics are even more complicated. So
yeah, wow. And in terms of kind of helping patients manage medications, do you get involved directly with the patient and not just the doctors?
Oh yeah, quite a bit actually. So because my practice is mainly geriatrics, my patients aren't always what I would call tech savvy. Like they're not necessarily looking for a program that will help them remember to take their medication or something. They're more phone call based or medication calendar based or pillbox. Like a little less tech savvy, if you will. My younger patients now, they're showing me all kinds of things. And some of my colleagues at other institutions, like University of Michigan, they're kind of leading the way for technology-based programs to help patients stay on track with their medications. They have all sorts of apps where the patient can be reminded about their medication, but also if they're having a problem, they can communicate with their healthcare team in real time over the app. So kind of like a wide spectrum of what is the patient the most comfortable with.
Yeah, because I feel like there's so many apps out there to kind of track medications and all of
Yeah,
that. So
yeah.
that must be harder with the older population to try to keep them compliant to their meds.
Well, and in general, older patients are on so many other medications as well. It really is a heavy burden to do all of this at once for an older patient. So again, they require maybe some different management than a younger patient might. But that's part of my job, right, is to figure out what resonates best with that individual patient, what is going to help them the most while we go through this.
Can you tell us a little bit about, I'm kind of going back to, I know that you are a survivor yourself.
I am.
And maybe just share kind of how that, your personal professional experience and how that impacted your treatment.
So 10 years ago, I had my first routine screening mammogram. Just, I was that age and it was that time. No family history, no symptoms, nothing. And there it was. I had stage 2 breast cancer. So, kind of the best and the worst luck all at the same time, right? Like my very first mammogram ever, and there it was. But also, I am so fortunate that my provider asked me to do that when she did. If I had ignored her advice, I don't like to think about the possibility. So my type of cancer did not require treatment with traditional chemo. So I had surgery and then hormonal therapy after that. So I didn't have the full experience that many of my patients are having, but I will say that experience taught me more empathy than I ever knew that I was lacking, right? Like before that experience, I thought I understood what my patients went through, and I really thought like I had a good grasp of having cancer and treating cancer and stuff. And it turns out I really didn't. Like I thought I did, but now I know better, right? I know deeper what the patients might be going through. And I think I appreciate more when a patient is upset or angry, because now I had a lot of those feelings myself. So I think that I hope that experience made me a better pharmacist, a better listener, better understanding. So.
I'm sure it did. And, we find that so often in terms of, the mission of CancerBuddy, the app, is to, share experiences and offer support to each other. And survivors, really want to also be in the app for their own support, but also to offer support to patients,
Mm-hmm.
because survivors in the app can connect to newly diagnosed. And because obviously they have so much empathy and compassion and knowledge, experience of what they went through to help shed light and experience and support the newly diagnosed patient that needs that.
Right. Yeah, in my own experience, everybody wanted to help and everybody wanted to, offer support and send love and send grace. But the ones that truly understood were patients or people that I knew that had been in that same situation. So
Mhm.
I will
And
also add that
how,
I asked all the hard questions of my oncologist. I
yeah,
think he dreaded our appointments because I asked all the hard questions about the drugs.
it's
So,
probably it is intimidating to a doctor to have somebody that comes in and that has so much knowledge base
yeah.
around their own medications and so
Well,
forth. So that's
but here's where I would advocate for having a good relationship with your physician, right? Like my physician, I absolutely appreciate that she let me challenge her. She
yeah.
appreciated when I kind of pushed back and said, "But what about this other study I just read, or this kind of?" So she heard me out, and I respect her for that.
How do you feel when you get kind of questioned by your patients that you work with,
Yeah, that's a
and
great question.
about their medications or
Yeah.
um, yeah.
So I love questions. Like I would much rather have a conversation of any kind than just like talk at somebody, right? So I love questions from patients that have looked things up on their own, read about this, heard about this, that want to kind of weigh the pros and cons. Again, that's part of my job here, is to sort through this huge amount of information and relay it in a way that means something to the patient. So I'm always happy to take
Mhm.
questions. Please don't ever hesitate, you guys, to talk to your pharmacist about anything. And it doesn't necessarily have to just be a cancer medication. That is
Mhm.
my area of expertise. But if you have a question about your medications for diabetes or hypertension or whatever, I can find that, or I can refer you to a pharmacist who knows more than I do. So don't ever hesitate to ask.
How do you feel about, because I often work with integrative doctors
Mm-hmm,
that are giving different sorts of supplements
mm-hmm,
and having them. I actually work with a great group in Utah that works with, that she was part of the anti-cancer book. I don't know if you've read that book, but it's a great book. And she did the research. She's a researcher in terms of, alternative therapies that support traditional therapies. And so she often works with a lot of cancer patients
mm-hmm.
to get them on the right supplements that will help. And one of the supplements that one of our patients took was just melatonin,
Oh, huh.
and that was supposed to help increase the effectiveness of the chemotherapy. Do you work with any kind of supplements, or how do you feel about that?
Yeah, so that is a wonderful question. I could probably talk about that all evening. Um, so, so I don't have an expertise in integrative medicine the way some practitioners do. Now, with
Mm-hmm.
that said, many of my patients ask questions about alternative therapies, herbal supplements, however we want to classify this. And my general take on that is that we just don't know enough about it yet, right? Like it might be wonderful, it might be terrible. We're not sure, but I can take better care of my patients if I know what they're doing. So what makes me nervous is when a patient doesn't ask me or inform me that they're taking an herbal product or they're considering that. Because if I don't know everything that's going into the patient's body, then I can't make a good recommendation, right?
Yes.
So I would say the verdict's still out on many of those therapies,
Mm-hmm.
but please keep me informed if you have
Right.
chosen to try one, because I want to make sure that what we're doing is safe and that it's
Mm-hmm.
not making your chemotherapy more toxic,
Yes.
that it's not contributing to something, another problem. So again, honesty is the best policy here. I will never pass judgment for a patient using an alternative therapy, but I do need to know that so I can take the best care of them.
That's great advice, because I think a lot of patients are
Mhm.
nervous to talk about even just taking their kind of vitamin regimen that they're
Right,
used to taking,
right.
and they don't even want to approach that with their physician. And often the physician doesn't really know about it, so then they never kind of get to the pharmacist to where they should be
Exactly.
speaking about
Exactly.
it.
I will say I have the clinic I work in now. The staff passes all of the herbal questions on to me. Like they don't even
Mhm.
answer them. It comes to me first, which again is very flattering, and that is my job. But again, if I don't know that's happening, what I told you about your chemotherapy might not be entirely accurate. So
Yeah.
please don't fear judgment or anything. We want to work together with all of your treatment group. So.
Hmm. Yeah, that's so true, and important point for patients, so they can be transparent and get the best care. And in terms of working with patients, and if you see different side effects and interactions that are happening,
Mhm.
do you do some sort of assessment with them to kind of really dig deep to see what could be causing those things?
Yeah, so depending on the setting that we're in, so I actually do both inpatient and a little bit of outpatient, like in a clinic. So inpatient, the patient is right there. I can ask questions. I can, visibly see the patient if we're talking about a rash or some other symptom. Outpatient, unless they're in the clinic that day, we'd be doing an assessment over the phone or over video.
Hmm.
So all of those are possible. Again, some health systems would do an actual like televisit. My institution doesn't do that with pharmacists yet. Like
Hmm.
pharmacists don't conduct television medicine or telemedicine visits. But again, if I need to see a patient's rash, they can send me a picture or we can FaceTime. So
Hmm.
depending on what their complaints are, it may need to be something that I see or that they just describe to me that they're having a headache or they feel nauseous. Um, Again, patients can also communicate with us through our portal, and eventually that message will get to me, the pharmacist. So we can communicate that way if that's the way the patient is most comfortable.
Okay, great. We have a question here about vitamin D increases as immunotherapy.
So I don't know if there's a lot of strong data on that. All
Hmm.
right, but what I will say is if you take high doses of vitamin D, it actually will deposit into your fat tissues. So you may actually run into a situation where the extra vitamin D is depositing throughout the fat tissues as opposed to just staying in the bloodstream. So I would always advocate for checking vitamin D levels if that's something that you were interested in. That's an easy blood test to be done. But I would want to make sure that the level hasn't gotten so high that it's going into other tissues. Um,
Hmm.
from a safety perspective, I would certainly tell your team that's what you're interested in or thinking about, and they
Hmm.
can monitor from a safety standpoint.
Right. And just from your other, challenges that you find in your profession, can you share anything that kind of stands out to yourself, as a pharmacist?
Yeah. Do you mean like with an individual
Yeah,
patient?
and
Oh, sure.
patients or even colleagues,
Oh, sure. Sure.
Yeah.
I would say probably most recently, we have a patient that has a pretty significant corn allergy. And corn is an inactive ingredient in many
Mhm.
medications. It's not, the
Wow.
drug but it's in a lot of fillers. It's in a lot of preservative things. So I've been spending quite a bit of time finding a drug that does not contain corn in any significant quantity. And so different companies make the same drug. And so three different companies might make the same drug with varying amounts of corn. So I've been spending some time calling those individual companies, finding what they put in this product, and then ordering that product specifically for our patient. So that's been a unique challenge for me. I've never had a patient with that severe of an allergic reaction to a common ingredient like corn before. But
Why is corn, is that a common additive
yeah,
to these drugs?
it's called a stabilizer. It's a common
Mhm.
stabilizer to keep drugs good on the shelf
Oh,
longer.
okay.
And in most cases, it's quite safe. But this particular patient has a significant corn allergy, and knew that coming into treatment with us. So it wasn't something we identified. She knew that previously. So that's been a real unique experience for me
Mhm.
to, dig that deep into what else is in this pill or this bottle. But
Mhm.
I'm really kind of proud of how we've managed to get her through what she needs for her cancer, in addition
Wow.
to the other like limitations that she has.
And
So that one
and
recently.
how did and so what you had to find drugs that did not have that as a additive or lower dose of that?
Yeah. So not only as an additive, but how much of an additive.
Hmm.
So, in one example, there were three companies that made the drug, and two of them used corn, one of them did not. But of the two, one of them had a much higher quantity of corn in their pill than the others. So, I learned way more than I ever knew
Wow. I
about
didn't
about
even know that corn was in
yeah.
that drugs.
Yeah,
Yeah.
so that one very recently was. I hope that we made a difference and made things more comfortable for her in her treatment.
Hmm.
Um, Probably my other long-term favorite was we had this cute little old 80-year-old man, grandfather, veteran, had served our country overseas, and he developed a blood cancer. And then he developed a complication of that. It's called iron overload. So he needed treatment for too much iron in his body.
Hmm.
And there are drugs for that. And one of them is an injection, and one of them is a pill. And we requested the pill because he's 80, and that seemed easier. And his insurance denied him that and said he needed the injection. And I just took that very personally,
Hmm.
right? I just was not backing down. Like, here's an old man that cannot give himself injections, that served our country. Like, I'm going to make this right. So I became so obnoxious with that insurance company that I think they gave him the pills to make me stop. Um, I
Wow.
I put it on my calendar every Monday. I was going to call them and report that he was having difficulty with the injections, and he's bruising, and he's having low blood pressure. And I honestly think that they just got tired of me. But if that's what it took, I'm
Wow.
so glad we did it. Like the day those pills were delivered, he and I hugged in the hallway. So
Wow.
I love like making a difference, even in a small way, for
But
the patients.
that's, yeah, I mean, just making the difference like that for a single patient is
Yeah,
amazing, and such, advocating for that patient.
right.
You don't often hear a doctor calling an insurance company to, advocate like that,
No.
because it's usually like the social worker or something like that. But
Yeah. Yeah. Well, in this
yes,
case, like I knew the side effects of the drug, so I could report that he was having them. And he was. I don't want to say I was dishonest. I was not. I was just loud about it.
yeah, that's
But
it's
yeah,
amazing.
that was, again, like maybe it wasn't the biggest intervention I've ever done for a patient, but it was probably one of the most meaningful. And it just, again, the patient, I think, was so much happier
Yeah.
taking pills and being injected at that age and stuff that I was really proud of that.
It's amazing how insurance companies have such power over doctor recommendations,
Yeah.
and because of the bottom line of a financial piece, it just
Yeah.
is really frustrating,
Yeah. It
for
is
patients.
frustrating. Just it's hard to know like what is the right answer other than my patient can't get their medication at least that we have chosen for them. But yeah, there's a lot. I will just say there's a lot of work to be done with healthcare reform in this country. So
Yeah, I agree with that. And in terms of kind of, challenging times with any colleagues, or just kind of some things that you have to navigate carefully, being a pharmacist and working as part of a team
sure.
and having different conflicting
Yeah.
thoughts.
I gotta say, like the team I work with now is so pharmacy friendly. Like they know what I can do. They ask for my opinion. They don't always take it, but I appreciate that they ask.
Hmm.
you know, um, I have worked with some colleagues that practiced for so long without a pharmacist on their team that they didn't really see the value in my services. Like it took me a
Hmm.
while to kind of, remind the physician that, hey, I'm here and I can do that, and please call me or please ask me.
Hmm.
But I've been at my current site long enough that now they know what I can do. They will call me and text me if I'm not in their line of sight. um,
Mm-hmm.
so, but I would say that my colleagues always hear me out, and I appreciate that. Like they take my opinion as part of everyone's decisions or everyone's opinions to make the right decision.
Yeah,
So,
it's really part of the educational process of team building
yeah,
and being a part of the team
yeah,
instead of working, solo. And so that's so important. And we have another question. Do you work with a nutritionist regularly with your patients?
all right, very good. So the institution I'm at now, we do have a nutrition service. So I am very fortunate that if a patient asks me a question about nutrition or about, how to supplement protein or something like that, if I can't answer it, I can call a formal nutrition consult. Most of the patients see our nutritionists anyway, but again, if I identify an issue that I'm not comfortable addressing, we do have them on site. So we are quite fortunate in the center that I'm at right
All
now.
right, that's wonderful. Yeah, that's such an important aspect of cancer care is, the holistic piece of it all.
Mhm.
So, yeah, that's wonderful. I guess in our closing, um, points, is there anything else that you think is important to share with our audience and cancer patients and survivors and
Well,
family members
yeah,
that are on tonight?
I would reiterate, please don't ever hesitate to ask to speak to your pharmacist if they're not a visible part of your team. Like there is probably a pharmacist nearby if you are receiving treatment with drugs in any institution, but you might not see them on in the hallways, depending on how many there are or what their role is. So if you haven't met them yet, please ask. We are more than willing to speak to any patient that has questions. Some of us just are pulled in multiple directions and can't meet every patient every day. So if we don't introduce ourselves to you, please ask to see us, number one. Number two, please tell us every medication, alternative, complementary, herbal,
Mhm,
prescription. We need to know all of that, right? As I
mhm.
said, we're not passing judgment, but we need to know so we can give you the best recommendation about all medications. Um,
Those
and
are,
I guess from my own personal standpoint, it's a privilege to be part of the team that takes care of all of our patients. So thank you for letting us be part of your journey. It's a true joy in my life to be able to do this. So
yeah, well, it's amazing just how important the whole team is. And patients, I think I've been a social worker for 35 years. And I don't think even when I worked in the hospital system early on in my career, rarely did we ever speak with a pharmacist about patient issues, being a social worker. And I think that that's also kind of an educational piece that is just important to be able to feel that the pharmacist is part of the team. And if a patient's having side effects and a lot of issues, that's a team member to go to
that,
as much as the
that
oncologist. And I don't think that that's always looked at.
right. Well, and that's
Yeah.
where I have to give a shout out to the group that arranged this
Yeah.
conversation. So I belong to a group called HOPA, so Hematology Oncology Pharmacy Association.
Mm-hmm.
So our little group of those of us that practice in the area of oncology pharmacy. And HOPA's mission is to have a pharmacist be an integral part of every cancer patient's care.
Mm-hmm.
So groups like HOPA are getting us out from our little closet or behind the counter and getting us out to show what we can do. Again, remind patients that we're here. As you mentioned, we have really stepped up our participation in a visible way
Mm-hmm.
in the last couple of years, and we're hoping to just keep doing that.
How does HOPA do that? Do they go and present with teams of doctors and so forth?
Yeah,
Or
so Hope is doing multiple things to increase awareness of the pharmacist.
mm-hmm.
So there's a group of us now, as you mentioned, we're called HOPA ambassadors. So
Mm-hmm.
5 of us that we call ourselves more seasoned members of HOPA. We're
Mm-hmm.
not exactly rookies in the cancer space. We've been around for a while. But we do things like this to increase awareness with patients. In a couple weeks, we're actually going to Washington, D.C. to do some advocacy on the national level to increase funding for cancer research, but also to mandate pharmacist participation in many areas of medical care. We're exploring some ways to go on college campuses to talk to pharmacy students about specializing in oncology. And again, many of us do events like this with patients at our own local events. So, for example, I'm in Pittsburgh. I'm going to be the speaker for an event in October for women's health. Again, to kind of get out and remind women to ask their pharmacist about questions they have about their medications.
Do you find that some patients of different ethnicities have a different feeling, kind of intimidation, or do you find that people are different?
Yeah. So what I would say is people of different ethnic backgrounds sometimes have a spiritual belief or a different kind of religious preference that I don't always know much about. But that's a very important component of their care and their acceptance of traditional, United States medicine.
Yes.
So that's always been a work in progress for me specifically. Pittsburgh, we're not exactly as diverse as some other parts of the country. Yeah. So it's definitely a work in progress for me. But I would, again, encourage my patients to tell me what is important to you. Like, if it is very important that you feel well enough to go to your religious service on Sundays, then let's talk about how we can stagger your medications so that you can do that.
Yeah, that's great that you work so closely with patients. It's so important, and it's great what Hope is doing to encourage the teams to include the pharmacist in a larger capacity. Well, it's been a pleasure to have you on our CancerBuddy Conversations, and would love to speak with you offline as well as just our work at the Bone Marrow and Cancer Foundation, and including more pharmacists on our medical board. So I'll speak with you about that as well.
That would be fantastic. And again, thank you for asking the invitation. It's a privilege to speak to you and all of our listeners. Sorry for the technical difficulties if that was on my end.
I think it was a combination of both of us. I'm not so savvy. Yeah. I'm always, it's my worst nightmare is to, have to deal with computers and tech. So,
but yes, if your audience would like to speak with me further, please share my information. I actually work at a university called Duquesne University in Pittsburgh, so look us up too. You can find me there. You can find me on HOPA's website. So I'm happy to have further conversations with anyone who's interested. And thanks again.
Yeah, thank you, and thank you for that offer to our patients. And it's a pleasure, and we'll be in touch.
All right. Thanks, everybody. Have a great
evening. Thank you.
Bye-bye.
Thanks, you too. Bye.